Hello and welcome, everyone. Thank you for joining us today. My name is Alyssa Tay, and I'm with the Collaborative for Health and Environment, also known as CHE. We are co-hosting this webinar with Concerned Health Professionals of New York, a program of the Science and Environmental Health Network. Please feel free to introduce yourself in the chat if you'd like to. I'm going to get us started with some quick housekeeping items. We invite you to type your questions in the Q&A box at any point, and we'll get to as many comments and questions as we can after the presentation. If you'd like to activate closed captions, you can do that by clicking the button at the bottom of your screen. This webinar is being recorded and will be presented with simultaneous English-Spanish interpretation, and it's scheduled to last for an hour and a quarter. If you'd like to download the slides, please visit the webinar page on our website at healthandenvironment.org. We'll put that direct link into the chat now. I'll now hand it over to our moderator, Carmi Ornstein from Concerned Health Professionals of New York.
Thanks, Alyssa. I'm Carmi Ornstein. I'm Program Director of Concerned Health Professionals of New York, CHPNY. And this is an initiative founded well over a decade ago in response to the possibility of fracking coming to New York State in the US. And we continued on following our 2014 ban on the practice. We continue our work bringing scientific and public health principles and findings to decision-making processes about fracking everywhere. And we support frontline communities and organizations who are dealing with this threat. For the past nearly 4 years, we've been part of the Science and Environmental Health Network, longtime close colleagues with CHE, our host of this webinar. We've published 9 editions of the Fracking Science Compendium, to which each of our speakers will refer from various perspectives today. We're thrilled to be bringing people together around this ever more urgent issue. We've banned it in New York, but the issue is ever more urgent in so many places, and bringing people together from across the Americas, and to introduce those who may not have been aware to the situation in Argentina. I'm really happy to introduce 3 people today that I've been incredibly privileged to work with and to share them with you today. So first I want to introduce Nancy Pinheiro. She is a technical scientific translator from Argentina. She's been involved in research and translation related to socio-environmental issues since 2016. She's a doctoral student in sociology at the State University of New York at Binghamton in the United States. And part of her work looks at the role of translation and linguistic justice in socio-environmental struggles, particularly in the case of fracking. And she connects the experiences of Argentina and the United States. She's published in academic and non-academic spaces, and she's translated several books. She's the co-founder of the women's translation collective, Territorio de Ideas, and a member of the journals New Voices in Translation Studies and Encounters in Translation. After we hear from Nancy, we'll move on to Kathleen Nolan, who is a pediatrician and environmental and public health advocate with training in epidemiology and research design. Dr. Nolan graduated with honors in philosophy and theology from St. Louis University in the United States and received her medical degree along with a master's of studies in law from Yale. She lives in the Catskills region of New York State, where she serves as Senior Research Director for the organization Catskill Mountain Keeper. Her work there focuses on articulating the health impacts of fracking and the state, national, and global importance of immediate shifts to clean energy solutions. She's the president of the New York chapter of Physicians for Social Responsibility. She's a co-founder of CHPNY and a co-author of the Fracking Science Compendium. Finally, we'll move to Fernando Cabrera, and he is the coordinator of Observatorio Petrolero Sur, an organization that's based in Argentina that aims to make energy production and consumption fairer, more democratic, healthier, and more sustainable. Fernando is a journalist, and he holds a master's degree in social sciences. His research topics focus on the social and environmental impacts of Argentina's hydrocarbon policy. He's published several articles in academic journals and newspapers and edited the book whose title we've translated as Industrial Hubs, Environmental Injustices, and Oil Industrialization in Argentina. And I will hand it over to Nancy.
Thank you for the introduction, Carmi. Can you all hear me well? Great. Welcome, everyone, and thanks for tuning in today, wherever you are. As Carmi said, I'm part of Territorio de Ideas, the women translators collective that has been working with UPSUR for almost 10 years now. And we want to thank Che and the Science and Environmental Health Network for their invitation too. Personally, I want to thank the people of UPSUR and also the Mapuche Confederation in Neuquén, because it is with them that I learn and that I do research related to translation, resistance, and language justice. And of course, I want to also thank my colleagues, Laura Berati and Laura Garcia, who've done a wonderful and painstaking translation job with the compendium, and they continue working on this project. So I want to give you a very brief background to the publication of the compendium in Spanish. And to situate it within the broader framework of language justice in socio-environmental struggles. Language justice is basically the right of every individual to understand and be understood in their preferred language. Both UPSUR in Argentina and also in association with other Latin American organizations, and concerned health professionals of New York in the US do translation work. That is the work of making technical and scientific information accessible to the general public, and particularly to affected communities. Therefore, they overcome a first obstacle. Now, we often hear that Latino communities are among the most affected in the US by the climate crisis and contamination. And given that Spanish is the second most widely spoken language in this country, and that many people who do speak English do so with limited proficiency, there's a second barrier to meaningful and broader participation in environmental justice efforts, and that is a language barrier in both regions. In the case of Argentina and Latin America in general, on the one hand, we often lack access to the type of scientific research that this compendium makes available. And on the other hand, of course, the US case study is a case study for its massive application of fracking. So taking these materials like the compendium and being able to provide quality translation in Spanish becomes a very powerful tool. But also within the US, this type of information is predominantly in English. For example, the Environmental Protection Agency, the EPA, commits to providing individuals with limited English proficiency meaningful access to their programs, activities, and services. And in addition, there are laws in place in the US that are supposed to guarantee language access, and those are, as we know, also under attack right now. However, just to give you one example, during the famous water crisis in Flint, Michigan, reporters and advocates found that Latino communities were alerted to the water crisis long after other residents, and they faced prolonged exposure to the effects of lead-contaminated water. Information didn't reach the residents because of the lack of Spanish language resources. The Frack Tracker Alliance has also emphasized that barriers to meaningful participation are exacerbated for non-English speakers, as hearings and notices are often not offered in other languages, even in regions where many of the residents don't speak English. Actually, there are some areas that in Texas that are called areas of linguistic isolation, and they are very close to fracking wells. we know that what happens on the ground and what is written on paper do not always match. So it is still up to organizations to build spaces of true access, because as the lingua franca of scientific knowledge, of technology and academia, English can be a barrier even in the US. And of course, all languages spoken in the affected territories need to be taken into account. And significantly, indigenous languages and the worldviews they express and represent. So initiatives like this strive to overcome those barriers, not only so that communities can be recipients of scientific information in their own language, but also so that they can provide their own input and knowledge of what happens in their territories on a daily basis. Most importantly, it's multilingual spaces like this one that allow us to share experiences and to learn from each other. And especially those in the global north can also learn what these brutal extractive projects look like in countries that historically bear the brunt of colonialism, extractivism, and neoliberalism. So to that end, I will now leave you with Kathy and then Fernando. Thank you very much.
Thank you so much, Nancy, Carmi, and Jay. I really endorse those goals and very, very happy to be here with you today to talk about the impacts of fracking in North and South America and what we can do about it. And I'll focus on pathways of contamination and human health impacts, knowing that Fernando is going to address some of the other elements of this topic. In talking about health impacts, I like to ask a simple set of questions. Is there a problem? Can we do something about the problem? And should we do something about the problem? So clearly with fracking, there is a problem. These are highly toxic chemicals that we use to drill and frack wells in order to extract what's called unconventional oil and gas that's not present in deep underground lakes. The chemicals include methane, brine, and additional liquid and gaseous toxins released from the fracked wells, as well as what we put into the wells. So there are multiple pathways of contamination, but primarily three. Contaminants that are released into the air through leaks in the equipment or from coming up through the well that has been drilled. Water that is contaminated underground through fractures, fissures, and natural connections under the ground that are made larger and more extensive by earthquakes and by the fracking activity, and then contaminants that are present in fracking waste. These contaminants then expose plants, animals, and people. And we've seen over the several decades now of experience with fracking, very worrisome analogies to human health problems in both plants and animals. But even more so, and a prominent feature of the compendium, are study after study after study showing harmful human health impacts. So let's talk a little bit about those. It turns out that some problems are harder to perceive than others. So on the left of this slide, you see a pump bringing up presumably gas and oil from the well here, and it may look like there's not much else that's coming up. But scientific equipment can show that there is methane and many other contaminants. Even without the scientific equipment, we can see in the photo on the top left that the methane coming up from the well often has to be burned, lit on fire, or what is called flared, to prevent a buildup of pressure. This is visible from the ground, and it's also visible from satellites that are orbiting the Earth. And if you see an overturned truck or an overturned canister storage vessel, then you can see the waste running on the ground. So both visible and invisible. On the next slide, I want to show you some of the things that can happen completely out of sight. On the left is a typical well, as you might see in a rural area. This one happens to be in Greece, but it could be anywhere around the world. And on the right, you'll see in the top what what a textbook might show as underground water and underground rock. And certainly the industry, oil and gas industry, shows things this way. Very straight, uniform layers separated from one from the other. But what we actually see when you do underground work, or if you do seismic testing, is that the underground surfaces are very fractured even before you begin oil and gas exploration. So there are pathways that water and these chemicals in the fracking solution can go into and cross-contaminate. Those are made worse when the fracking activity begins. It turns out that there is evidence for adverse impacts from fracking in virtually every human organ system. And I chose this slide because it was one of the few I could find that included a picture of a woman's organ system, in addition to what appears to be a man's organ system. You can't see it in the part of the slide that is showing here. This slide is an indication of the complexity of the human system. And in the next slide, I've listed out some of the places where we see harmful health impacts from fracking. Top line is that many studies now show premature death in areas near fracking sites and along fracking infrastructure, such as compressor stations and pipelines. People dying early is a manifestation of the multiple ways in which fracking can harm people. It's kind of a way that the human body brings together all the impacts and just isn't able to cope. There are also studies showing specific increases in heart attacks, heart failure, and ischemic heart disease. There are studies showing asthma and other respiratory disease, both onset of asthma and worsening of asthma, with increased trips to the emergency room and hospital. There are studies that indicate that people living closer to well sites have an increased incidence of cancer. And specifically, a very good study showing that ALL, a particular type of leukemia that occurs in children, is increased. This is striking because that's a type of leukemia that is also seen in adults that work in the oil and gas industry, especially very close to gas wells. Less attention has been paid to the skin lesions that show up in many people living near fracking sites. These are prominent to me because they resemble chemical burns. They're not a typical skin diagnosis as we might see in somebody coming into the office more generally. So it can point towards an oil and gas type of exposure if a healthcare professional sees this. It also is an indicator often of air exposure because the body skin areas that are exposed are those that show these lesions. Although I have seen them in people who have water contamination, then they have them all over their body because they're getting exposed in their showers. So paying attention to where these particular problems show up can help us understand how an exposure is happening. I'm trained as a pediatrician, so one of the most difficult areas for me is that near oil and gas wells, women have more difficult pregnancies with a condition called eclampsia, which is high blood pressure and other problems related to that during the pregnancy, and infants that are born preterm before 40 weeks, or infants born at very low birth weight, and in some cases, infants born with congenital malformations. This is something that was also seen in many of the animal model studies, and something that I saw when I visited Argentina in a group on the Patagonian plateau that had had very pure water until fracking started, and then started seeing in the people and in the animals a whole set of problems they had never seen before. There is also evidence in multiple studies of neurologic and psychological injuries, including seizures, anxiety, and depression. There's also, I didn't include it on the side, but there's also increased auto accidents in some areas near fracking, which is thought to relate to the earthquakes that fracking causes, which then lead to a generalized anxiety, which may show up in a tendency to have an auto accident. These studies come from around the world. They are studies that look at different levels. Some are at local impacts, some regional, some national, and many studies at the global level, including using satellites, as I mentioned before. The bulk of studies come from the United States, but there are also studies in Canada, Argentina, Mexico, England, Ireland, Europe, China, Australia, actually many other countries. But the bulk of the research is in those that I have listed here. So what are we supposed to do about this? Well, the hallmark of clinical medicine is to prevent disease. It's much easier than trying to treat disease. And to prevent illness in this case, we have to prevent exposures. But we cannot really prevent these subsurface fractures and interconnections that come from fracking. That is, the nature of the enterprise is to use high pressure to fracture the underground rock. So you have to have fracturing in fracking. You also cannot prevent leaks of gases at the wellheads, although you can try to minimize that. You cannot prevent leaks and spills of liquids and waste during transport and during storage, although you can try to minimize that. There's been an attempt to remove the fracking activities from houses and businesses and churches, places of worship, to set those activities back from where people are gathering. But the distance at which you have to go has not been precisely determined, and studies show increasing distances at which you can see harmful impacts. So initially we thought you had to be very close to a fracking site to see these impacts. Now more and more research shows impacts at 5, 10 kilometers, several miles. And my belief is because of the tendency of fractures underground to increase over time, that we may see more widespread impacts as we go out in time. Treatment of fracking-related illnesses may be difficult or impossible in some cases. And so our best intervention here is to prevent exposures by minimizing or eliminating fracking activities. Now, we all know that's a huge lift. We've managed to accomplish it in New York State before fracking got started. There have been a couple of other states that have fracking bans, and there's many places that have not been able to do it. So while we continue to do this work, we have to find good colleagues to do it with and share our experience with each other so that we can be more successful and so that we can help places that have not started with this activity to keep it banned and to begin to roll it back around the world where these harms are being seen. So this is a picture from that trip a few years ago in Argentina. And I'd like to introduce my Argentinian colleague, journalist Fernando Cabrera, for him to talk a little bit about some of the things that he has seen, witnessed, and documented in Argentina. Thank you.
Gracias, Katy. Una alegría para nosotros estar en esta jornada con dos grandes amigas, Nancy, a quien conocemos hace más de 10 años, y bueno, Katy, que pudo estar en 2016 por acá conociendo un poco lo que está sucediendo en el norte de la Patagonia, en una formación que desde los gobiernos plantean que quiere ser como Texas, que sueña que sea como Texas, como una cosa buena, y se llama Vaca Muerta. Es una formación que fue la primera que estuvo profundamente fracturada en Latinoamérica, que implica 4 provincias, en una de las cuales vivo yo, que se llama Neuquén, y que desde el 2013 está siendo fracturada. Hoy hay unos 3.000 pozos de fracking realizados a orillas de ríos muy importantes, de los más importantes de Argentina. Mi conversación hoy tenía que ver un poco con eh, plantear algunas cosas que venimos viendo, que el compendio nos ha ayudado a ver y que, bueno, que se ven en el día a día del trabajo allí, para intentar dimensionar lo que no vemos y poder tener una idea de que hay un montón de cosas que no vemos, pero ya lo que se ve es muy grave. ¿Qué vemos entonces de qué está pasando en Vaca Muerta? Vemos grandes consumos de agua, vemos una cantidad de residuos tóxicos difícilmente manejables, vemos la aparición de sismos, que era algo que no sucedía. Vemos una gran ocupación territorial por parte de la explotación y también una serie de accidentes laborales y de incidentes ambientales notables. Ahí en esa foto lo que se ve es en el fondo una planta de arenas, que también es un tema importante a tratar, pero no nos vamos a meter hoy, de arenas para fracking, y en primer plano son grandes mangueras, acueductos por los que llevan agua del río Neuquén hacia las formaciones, hacia la explotación con fracking. Entonces sí, ahora vamos a lo que es al primer tema que tiene que ver con el agua. Cada pozo de agua, pasamos a la siguiente diapositiva. Cada pozo de agua hoy consume como tendencia, como la mayoría, 60.000 metros cúbicos, que es algo así como el porcentaje lo consumen 100.000 personas que viven en Estados Unidos o 200.000 personas en un día en Noruega. Pero esos son los pozos normales. Hay pozos que duplican esa cantidad con 140.000 metros cúbicos de agua que nos vuelve al ciclo hidrológico. Muchas veces comparan lo que consume, por ejemplo, la fruticultura, que es una industria o una producción importante en la región. Y bueno, la gran diferencia es que esta es agua que se contamina y se abandona. Queda en el subsuelo, ya sea la que queda en el subsuelo por la fractura o un porcentaje importante que vuelve a la superficie de un 25 o 30%, es nuevamente reinyectada y a la espera de que no contamine el subsuelo, abandonada ahí. Entonces estamos abandonando 100.000 metros cúbicos, para decir un promedio, de agua de primera calidad por pozo que estamos haciendo. Y como les decía, ya hay 3.000 pozos y se espera que esto se multiplique. La otra filmina. Ahí estamos viendo otro problema vinculado con el agua. Ese es un lago que da agua a mi ciudad, a la ciudad de Neuquén, la ciudad más importante de la Patagonia Argentina, y está fracturado por explotación no convencional, pero también tiene mucha explotación o tubo eh, convencional. Ahora vamos a ver una imagen y bueno, ahí hay también toda una serie de preocupaciones sobre qué está pasando entre la cercanía de los pozos y el agua. La siguiente. Bueno, como les decía, otro tema tiene que ver con los movimientos sísmicos, una zona que no temblaba, una zona que no hay registro de movimientos sísmicos desde que tiene registros Argentina, y que a partir de 2018, cuando se hizo un importante yacimiento, empezó a moverse y desde entonces hubo más de 500 movimientos sísmicos Ayer hubo uno, hoy hubo otro en mi provincia. Que no tuvieron respuesta gubernamental. Inicialmente los funcionarios plantearon que no estaba vinculado con el tema, que había que estudiar, y hoy ya no responden nada, hay un silencio frente a las denuncias y no han dado respuesta a los vecinos, las vecinas de pequeños poblados rurales a los cuales se les rompió la casa, también comunidades indígenas mapuche, no han dado ningún tipo de respuesta y hoy hay un silencio eh, preocupante tanto de los gobiernos como de las empresas, aunque sabemos que en silencio están pensando normativas, legislación, pero no hay ninguna respuesta pública sobre la situación, cuando hay un consenso ya importante científico de que hay una vinculación directa entre el fracking y estos movimientos, algo que los vecinos decían desde el principio. Ahí vemos un mapa de una organización amiga que se llama Observatorio de Sismicidad Inducida. En amarillo vemos los sismos, las estrellas amarillas, y ahí vemos otro lago, un lago que está vinculado con el anterior, que como les decía, es el tanque de agua de la ciudad más importante de la Patagonia Argentina. Y en verde vemos pozos convencionales y no convencionales alrededor de un río, se llega a ver el valle, que es el río Neuquén, donde sacan agua para la actividad. Y bueno, ahí un poco da cuenta de una zona que no temblaba en 6 7 años, se ha movido más de 500 veces. La otra filmina. El otro tema central es la basura. Esta técnica, por su propia dinámica, genera un montón de residuos, de barros empetrolados, de residuos semisólidos, que son acopiados en grandes plantas, en grandes espacios, lugares de 15 20 40 hectáreas, eh, que no tienen capacidad de tratamiento y que se han convertido en espacios donde se acopia la basura y prácticamente se deja abandonada ahí con un tratamiento muy lento. En la imagen vemos una foto de la situación más emblemática, que es una planta ubicada a pocos metros de la ciudad de Neuquén, se está trasladando una nueva localización desde el 2018, pero todavía no terminó de procesar esos residuos. Hay una denuncia penal, un juicio que se está sucediendo, y a raíz de eso empezaron a mover los residuos hacia otra planta que tampoco cumple con una normativa que dice que tienen que estar estas plantas instaladas a más de 8 kilómetros de la urbanización. Esta planta estaba entonces, 2017, 18, a 500 metros y hoy está barrios, están loteando barrios, están entregando casas a vecinos a menos metros. Pero bueno, la basura que están sacando de esta planta en el marco de una causa penal, como les contaba, la están llevando a otra planta que tampoco cumple con este requisito de distancia, pero está en la ciudad más alejada, menos importante para el gobierno, que no cumple con esta distancia mínima. La siguiente, por favor. Así se ve un poco estas plantas que nosotros le decimos irónicamente basureros petroleros y no plantas de tratamiento, como sería su nombre técnico, porque lo que hacen es justamente juntar basura sin tratar, abandonándola ahí o no abandonándola, pero sin tratamiento durante muchos, muchos años. La próxima. Por último, un tema del cual la visita de Katy en 2016 a Argentina nos hizo tomar conciencia, que tiene que ver con los accidentes, en aquel momento los accidentes laborales, desde el compendio advertían que había una tasa de mortalidad muy importante en la actividad del fracking, y eso poco tiempo después se constató, se registran eh, del 2017 al 2023 se registraron 15 obreros muertos en operaciones de la actividad, algo que no era habitual ni mucho menos. Posteriormente a eso hubo otros muertos. Como decía Katy, hay una serie de problemas vinculados con el traslado al trabajo también, muchos accidentes viales, algunos mortales, pero estas situaciones de muerte en el trabajo son quizás la situación más dramática, pero hay una serie de accidentes menores que pueden terminar en mutilaciones o en grandes golpes que no se registran tan habitualmente. Por otro lado, vinculado con los accidentes o incidentes ambientales también, toda una serie de situaciones no esperadas dentro de la explotación, como podemos ver ahí la ruptura de un gran oleoducto, el oleoducto más importante de Argentina, que bueno, está muy precariamente contenida en la imagen. Entre 2017 y 2021, la cantidad de incidentes ambientales eh, eh, registrados por el estado de Neuquén, que es la provincia más vinculada con este tipo de explotación, se duplicó. Y seguramente ese número sigue en ascenso. La siguiente, por favor. Eso empieza a pasar regularmente en las locaciones, en los lugares de los pozos, empieza a haber como monolitos recordando a los obreros que murieron por accidentes. Esto es cada vez más común, eso es una pequeña refinería que se incendió y sin ningún tipo de seguridad murieron allí 3 trabajadores. La siguiente. Y bueno, hay una serie de accidentes de envergadura, incidentes de envergadura que han ocurrido en la historia de esta explotación que lleva más de 10 años y se han podido registrar, aunque bueno, como les decía, son cotidianas las afectaciones ambientales. Ya para ir cerrando la anteúltima, creo que es, Silmina. Lo que no se ve, si esto es todo lo que se ve y podemos dimensionar y es reconocible por cualquier vecino, lo que no se ve también es muy preocupante, es más preocupante. ¿Qué está pasando en el subsuelo? ¿Cuáles son los impactos y las afectaciones de esa tierra tan transformada en el subsuelo? Las emisiones, que bueno, es muy difícil de rastrear. Hay justamente una imagen de las emisiones con una cámara especial. ¿Cuáles son los efectos a salud a largo plazo, más allá de las primeras situaciones más vinculadas con la piel o la respiración? ¿Qué está pasando con las transformaciones profundas de la salud? Problemas endocrinológicos, por ejemplo. Y otro tema que nos preocupa mucho tiene que ver con la calidad del agua, que bueno, no estamos seguros de la calidad del agua que estamos tomando. Una más. Esto, si siempre fue difícil vincular un desarrollo, una producción con la salud, en este caso tiene particularidades vinculadas con la falta de voluntad política, la falta de voluntad de los políticos que están muy vinculados con la explotación y quieren que avance. Hay un consenso social en Argentina vinculado con que es la empresa nacional la primera que empezó con esto y tuvo una gran campaña gubernamental y hay una expectativa de que la crisis argentina se solucione con este tipo de explotación. Y finalmente un desinterés científico, una falta de vocación, una falta de ímpetu del sector científico académico para tomar estos temas de la salud y la explotación petrolera, que se vincula además con los 2 puntos anteriores con la articulación entre empresas petroleras y universidades o institutos académicos, y por otro lado, no menor, los costos, grandes costos de este tipo de investigaciones. Una más. Por eso, ante esta falta, ante esta incertidumbre, ante esta incapacidad de llegar a datos certeros, el compendio nos ha servido sobremanera para aprender y anticiparnos a lo que puede venir. Estados Unidos ha sido siempre un poco más adelante en los desarrollos y en los problemas. Tiene más capacidad de investigación, una historia más larga. Entonces, traducir lo que viene pasando en Estados Unidos ha servido para un poco anticiparnos y ir viendo algunas cuestiones. Y esta es la tercera traducción que se hace al castellano del compendio, que hizo Territorio de Ideas, que fue apoyada por la Fundación Bol, que fue apoyada por 20 organizaciones de toda América. Esperamos poder continuarla, es solo un capítulo, pero nos ha servido sobremanera para algunos debates que hemos tenido en el último tiempo. Ahora sí termino, disculpen la extensión. Queremos, bueno, agradecerles y decir que este es nuestro granito de arena para intentar que estas políticas que vienen como irrefrenables, poder torcerlas y hacer de esto un mundo que valga la pena ser vivido. Muchas gracias.
Thanks so much, Fernanda. Thanks so much to all the speakers. We're going to turn to Q&A now, and Nancy Pinheiro is going to help with that too, as will the interpreters. If you have questions in Spanish, please feel free to put them in Spanish in the Q&A box. We don't have any yet in Spanish, but please feel free. Also, I should say, I'm not sure, maybe we will get to all the questions, but if we don't, then we plan to collect them. All the presenters will answer them and we'll translate them into Spanish if they're in English, and those will be posted on the CHE website with the other resources for this webinar. So I will pick up I'll give you a comment before a question. And that's from Craig Stevens in Pennsylvania. They have long been giving fracked finding tours in Dimick, Pennsylvania, which is basically ground zero. So everyone is welcome to get in touch with Craig Stevens about seeing what they experienced there firsthand. This is just a few hours away from New York City and Albany. I believe Rachel is putting Craig's contact information in the chat. So please, if you haven't yet, take him up on that. Forgive me if I missed that Fernando addressed this one, but how are workers in the fracking industry in Argentina resolving the contradiction of working in an industry that is also harming them and their families? Are they joining forces with the environmental movement? Thank you, Pablo, for that question.
Es un tema que todavía no ha tenido respuesta ni sindical, ni ha habido movimientos de trabajadores cuestionando esto. Ciertamente hay un beneficio económico a quienes trabajan en el petróleo en relación a otras áreas, y eso hace que sea difícil que se opongan o que tengan algún tipo de debate sobre estos temas. Y el sindicato no ha colaborado tampoco en volver esto un tema de agenda pública. Así que yo diría que no hay demasiado activismo sindical ni obrero respecto a la salud y las afectaciones laborales que genera el fracking.
I would also like to say that a lot of the yes, a lot of the information that we have about the harmful health impacts of fracking, we have anticipated because of those health impacts seen in workers. And some of the people who have been most helpful for bringing forward the reality of these harms have been people working in the industry. It's one of the most dangerous industries in which a person can work. But it is in some places the highest paying or the most easily entered realm for employment. So we see people going into the field because they have to, essentially. So one of the reasons I focus on a transition to cleaner energy is because having jobs in solar and wind is a much preferable alternative, both for the people living near those industrial sites and for the people working in them. And I would encourage people who have access to northern Pennsylvania to contact Craig Stevens for a tour. It's through the generosity of people from Dimick and other places that have suffered from fracking that I know most of what I know, and from conversations and experiences with them, as well as from the people in Noken and the Patagonian Plateau. When people tell their stories, it really helps us as researchers, as well as then we hope going into policymakers.
Thanks, Fernando. Thanks, Kathy. I'm not necessarily going in order here because I'm going to switch to a question in Spanish. So Nancy will read that and let us know who should take that question.
Thank you, Carmi. So we have a question in Spanish. It says, thank you for the information on fracking in Argentina. I've been interested in studying the health impacts on workers and also communities living near the fracking sites. Do you know if there's interest in this type of research in the area? And just to clarify, I'm a researcher and I study the effects of endocrine disruptors on the nervous and reproductive system. I'm in touch with doctors who would be interested in participating in this research. Can I contact you here? And how have you, if you've succeeded in having scientists and researchers contribute to these problems to give further clarity on the consequences of this industry. So I'm assuming that's for Fernando.
Gracias, Nancy. Gracias por la pregunta. Cuando en 2016 invitamos a Katy, a Sandra, unas de las promotoras del compendio, nuestra idea era promover que otros, más que supieran el tema, médicos, gente de la salud, tomaran esta arista, este eje de debate vinculado con el petróleo y salud, y realmente no tuvimos éxito. No hubo, si bien fue muy interesante y la visita, estuvimos en hospitales, en universidades, en el Parlamento, no hubo sectores que asumieran este tema. Nuestra apuesta es seguir trabajando sobre el mismo, así que pongámonos en contacto, sería muy interesante poder hacer algo. Ciertamente hay una vacancia, hay una falta de investigación en el tema, así que sería muy productivo poder hacer algo al respecto.
And maybe I can add that we do believe that many of the harmful health impacts are due to the endocrine disrupting function of these chemicals. So that would be a particularly good area of study. There are studies of that nature from the United States. But when you have information about that is derived locally, that can be more powerful sometimes in having that political pressure.
Thanks to you both. I just want to say there are a lot of really great questions coming in. So please remember that we'll have this project afterwards if we don't get to your question, and those will show up online. So this is, I think I understand this question. It's looking for strategies and insights about doing community-led or scholarly ground truthing and monitoring in these areas, knowing the fracking industry is saturated and or the general lack of political will. So I believe this is a question how we're getting participatory research done and also monitoring what's actually going on the ground. I mean, we deal with this a lot at CHPNY, where it feels very strange to be watching the research come in and being witness to these harmful effects. And we value the research community and the research so much, and we're, like everyone else, in a bit of a panic about what's going to happen to research. But we also know that the data is in. We know that there are all of these effects that Kathy outlined in one of her initial slides. But nevertheless, people are experiencing this. So how do we bear witness to that? How do we study it? How do we make sure communities are involved in that research? And I hope that I've gotten the nature of that question right. So if someone wants to speak to the strategies or insights on how to get that done and do it right.
There are some groups that will work with people who are interested in doing that kind of ground truthing. And it can be helpful to have a way of bringing together people who may be suffering with conditions that they don't attribute to their exposure to the oil and gas activity that's going on near them. When they come together and they see that other people were healthy until a certain time when that activity started, and now they're all sick, it becomes very real that something changed in that community. So it would depend upon each particular community, and we can make resources available to individuals. I do want to say a word about using the compendium and why I didn't put a whole lot of study citations in my presentation. The compendium is set up with simple language explanations of this research for thousands of research papers. So one of the first things a community could do is get together with a compendium and a particular concern, like a skin condition, and just search skin condition in the compendium, search asthma, search cancer. That then you can generate a list of 6 research papers and go read the research papers together. The compendium gives it to you in a simple summary format for just quick action. But if you really want to dive in on any particular subject, the compendium is set up to be easy to use for that purpose. And now to have the most recent edition available in Spanish, I think that there should be communities that organize to educate individuals and then to go to their elected officials really armed with this information about what's happening in them as people, but also how this is explained as coming from something that has come into their community, the fracking activity.
Thank you, Kathy. And I should add that sometimes our summaries of the research are quite, they're simple, but they're detailed. And one of the reasons they're detailed is because some of the studies will actually be behind paywalls. And if you don't have access to an academic library, then we've done that work for you. So in a lot of cases, you can get the complete study if you want to go beyond our summary, but in a lot of cases, that's just not possible unless you have that access or want to pay a certain amount per study. So just thought I'd let you know that. Fernando, did you want to add anything about that kind of frontline community research question?
Que es muy difícil desde las comunidades afectadas en Argentina dar el salto a poder estar discutiendo temas de salud, como que frente a los impactos no hay respuesta ni gubernamental fundamentalmente que pueda orientar o acompañar, entonces están muy en soledad y en general son comunidades muy perjudicadas, en una situación de pobreza o lejanía de la ciudad, entonces es muy difícil que se pueda sistematizar. Algo que no dije es que en general, donde está la zona de pozos, hay una densidad poblacional muy baja, que quizás es distinto a otros lugares donde hay mayor cantidad de personas y pueblos y ciudades. En general, hay comunidades alejadas, sectores campesinos, comunidades indígenas, pero eso con bastante distancia entre las pequeñas poblaciones.
Thank you, Fernando. And also, Peggy Cabrera has reminded us that actually a local library can often do an interlibrary loan for specific academic articles. Thank you, Peggy. I just want to say, because it's a frontline response before we get to the next question, that Ray Kemble from DIMIC is on this call, and he gives his phone number and contact address because he has both worked in the industry and his home has been affected. Thank you, Ray, and ongoing sympathies for the situation. I'm going to hand it to Nancy to take another question that's been submitted in Spanish.
So we have Suyai Kilapan, and I'm assuming this is for all the panelists. It's how have you managed to have scientists and researchers contribute with the research to bring more clarity to the murderous consequences of this industry?
Fernando, I think you probably have the most important to say on this. I would just say in the United States, it has not been difficult. 10 or 15 years ago, there were only a handful of studies. So those investigators may have had some difficulty. But the topic of fracking became a subject of academic interest. And so researchers across the country have been able to study these impacts. They have sometimes been funded to study them by private funding. They have sometimes worked for US government agencies in the past to study this. The USGS, the Geological Society, has done important work. So academic research of this nature in the United States has not been difficult. And I think in Canada, it has. I have met researchers who similarly have been able to make this their area of focus. I think it is potentially more difficult in other countries, and especially difficult if the state, the government, is involved in managing, running the fracking activity. Fernando?
Eh, sí, nosotros lo que vemos es que en Estados Unidos hay una cantidad de publicaciones que no son comparables con la cantidad de desarrollo científico que hay en Argentina, donde el Estado no ha hecho investigación ninguna, como puede ser la Agencia de Protección Ambiental de Estados Unidos o la Agencia Geológica. En Argentina no hay nada de eso gubernamental. Y después los esfuerzos científicos son esfuerzos muy individuales, con muy poco presupuesto, en un contexto que coincide en una universidad argentina que viene una crisis grande en los últimos 10, 15 años. Entonces hay un contexto también difícil para la ciencia en el país. Así que los avances que se han logrado tienen que ver más con esfuerzos individuales o de pequeñitos grupos de investigadores con mucho esfuerzo personal.
We'll probably be going the way of Argentina in that respect soon. We know already that funding is being withdrawn for some ongoing federally funded fracking-related studies. I was on a webinar where some preliminary results were presented, and they were very, very important, and they were unique. And it remains to be seen whether we will get to see that study come to fruition. So I think we've had it pretty good with research in the US, and I hope that we can reclaim that role soon. So we have an important question from Francis Walsh about methane leakage with regard to fracking activities. And this is a good question. This is huge. Fracking contributes an enormous amount to methane emissions from several areas of the world. Kathy, do you want to say a bit more about that?
So what is called natural gas in English is predominantly methane. It's methane and a mixture of other short chain hydrocarbons. So the effort is to take this methane gas, which is locked away safe under the ground, thousands of meters under the ground, and bring it up to the surface so that we can capture it and use it. It leaks from the wellheads and from every part of the transportation and use. And it's estimated that 20% or so of global warming and climate change may be attributable to this activity. So you have leakage at the wellhead, you have the flaring, which is burning of methane. So some of it burns, but some of it doesn't, and that goes into the atmosphere. Then when you try to compress the gas, it leaks out of the compressing equipment, it leaks out of the pipelines that transport it. And both Carmi and I have been advising people, warning people about the fact that it leaks into your homes if you're burning natural gas in appliances, and particularly in gas stoves. So every stage along the way, we're taking this potentially harmful substance. It's mainly harmful to the planet overall rather than directly noxious to humans. But it carries with it all the contaminants that I was talking about. So at the global level and for regional air quality, the leakage in this system is just horrible. And efforts have been made to reduce it, and that helps, but it's really marginal compared to the amount of methane. Methane is much more potent in the short term than carbon dioxide in creating that greenhouse gas effect and warming the atmosphere. So if we take methane out of the equation, we make big progress very quickly. And if we don't do that, we slide very quickly into the kinds of weather and melting glacier situations that we're seeing.
Just piggybacking on what Kathy said about gas appliances in the home, buildings are a big source of greenhouse gas emissions and problematic for the indoors because, like Kathy said, of everything the methane carries. And gas stoves leak methane whether they're on or off, which is a finding from our colleagues at PSC Healthy Energy that we feel like should get out there quite aggressively, that we think people need to know that information. This is a great question about do fracking workers get sicker than conventional oil workers? I'm not sure that much direct comparison has been done, but we shouldn't we need to say that conventional oil and gas workers face an enormous slate of hazards and injuries and safety problems on the job. So I'm not sure about comparison studies, Kathy. We could look into that one afterwards.
Yeah, I'm not aware of any direct comparisons, but it would be a good question to ask. You might be able to answer it from some of the research that's been done in both fields. There was a question I did want to answer, though, that deals with comparisons. Could I jump in here with that? There was a question about whether there's any direct comparisons of fracked and unfracked areas. And there is a recent study that it does just that, looking at areas in southern New York along a border where there were several counties that were not fracked because of our ban. And then they adjoin counties in northern Pennsylvania that were fracked because they don't have that ban. And over the 6 or 8 years of the study, the health of the people in New York stayed the same or improved, and the health of the people in Pennsylvania declined, particularly in terms of heart disease. So that was some of the heart disease information that I was mentioning, and there's a reference to that that's in the chat. That is also available, a summary of that study in the compendium if you just search for Pennsylvania and I think heart attacks. Probably the easiest way for that study citation to come up. But we knew we were doing something important in New York, and now there is very good research to show that.
Thanks, Kathy. And I put the link to that study in the chat. I'm going to skip over to a question about the translation and what we do from here. We should clarify that the latest translation done by Opsur is of a significant portion of the compendium. It's what we call the infrastructure section, and that covers pipelines, compressor stations, all the way into the homes with the gas appliances. So that's what we have available from the 9th edition. We have some earlier translations. There's a combined 3rd and 6th edition translation. I'll put the link in the chat where you have up to our 6th edition. If you combine those two translations, you have the whole compendium. But the question here is, there are plans for more of the 9th edition to be translated. So we'll keep you posted on that. But the question is, what's the next steps needed to get the word out? Is there a campaign for getting it in front of CBOs in the US, for instance, where they live near fracking? And I'll just say, I think the person asking this is asking about everywhere because they've asked about the translation. But here in the US, we do kind of rely on frontline communities coming to us at CHPNY, and then we try to do what they need to support their campaigns on the ground. We also do like a lot. We do social media, we do all kinds of webinars and presentations, but frontline communities should definitely come to us if there's something we can do to inform their campaign further or support it somehow with the kind of information that we collect. But I think this is a great question. Maybe Nancy has something to say about what gets done with translated science. Maybe Fernando has something to say about their next steps in Argentina.
Thank you, Carmi. With regards to translation in a broad sense, as I said at the beginning, of not only translating resources, but also generating popular knowledge with people on the ground. I think UPSUR and other local organizations have been doing a great work in, like, despite the lack of resources and despite the lack of political will, and even the lack of scientific research, there is a very strong educational, I think, element in the work that they do and that is being done in Argentina and other Latin American countries. That I've seen UPSUR taking these materials to local public libraries in very small rural towns, working with teachers' unions. So I think the construction of this and the dissemination of this knowledge is very powerful. And I think perhaps Fernando can also mention there's the case in Colombia. There's an oil workers union that has opposed fracking, so perhaps that's also an interesting case to learn from.
Desde el OBSUR, el Observatorio Petrolero Sur, nosotros pensamos la traducción como una herramienta no argentina, sino para quienes hablamos el español. Entonces, Latinoamérica siempre lo pensamos como por lo menos latinoamericano. Hoy Nancy decía, bueno, hay mucho hispanohablante en Estados Unidos. Y al respecto ya se presentó con algunos grupos, con la Alianza Mexicana, Latinoamericana frente al fracking en México. Se presentó con una alianza colombiana frente al fracking en Colombia. Entonces estamos con esas redes trabajando. En Colombia hay un gobierno que ha permitido algunos debates al respecto. No está avanzando, si bien no ha podido instalar una ley, no está avanzando en proyectos de fracking. Y hay un debate si el gobierno cambia, qué va a pasar. Y hay algo de la fuerza de los movimientos sociales que han logrado que esto sea así. Como decía Nancy, un paso muy importante fue en 2019, cuando la Unión Obrera Sindical Colombiana, en un congreso, definió que ellos iban a estar en contra del fracking, es decir, los propios obreros petroleros no iban a estar por todos estos argumentos favoreciendo que entrara esta técnica que todavía no ingresó al país, por todo, entre otras cosas por la cuestión sanitaria y porque ellos decían en ese momento nosotros somos parte del territorio, no estamos ajenos a lo que pasa en nuestras comunidades. Y por eso mismo lograron, entonces son una fuerza importante, o que tuvo mucha importancia en el debate, que hoy está más flaqueando, no tiene tanto ímpetu como en 2019, pero que sigue siendo la posición oficial del sindicato petrolero colombiano, insisto, un país que tiene mucho de petróleo en su economía, sigue estando opuesta a la instalación de esta técnica.
Thanks to both. I think we probably can only take one more question, but I wanted to acknowledge that all the questions are great and we will answer them afterwards. I also want to acknowledge Marcia Richmond mentioning Dr. Theo Colburn, who I think we can she's legendary. There's stories about when fracking came to Colorado. She followed fracking trucks around and demanded to see their material safety data sheet to know what kind of chemicals were used. I could safely say she kind of launched at least some lines of research on fracking health effects. And I think that also relates to Skye Wheeler's question, which is the involvement of endocrine disruptors. And I think to do that question justice, we'll answer it offline. Thank you. And then maybe the same goes with the mental health impacts question, which is a really good one and one that could be easily answered by doing some search terms in the 9th edition compendium. We also pulled out public health themes, including mental health problems, as one of our sort of themes in the introductory section, where we are highlighting new trends in the research, where we've gotten some data where we might not have had it before, and mental health impacts are within that. That's page 61 of the 9th edition compendium. There have been a handful of studies on stress, mental health impacts, including one, unless this came after the last edition came out, on mental health impacts in pregnant people. I think it might have, so we'll put that into our Q&A. And maybe with that, I should just see if any of the speakers would like to say anything in closing that either is a continued response to a question or something they may not have gotten a chance to say. Nancy, do you want to, do you have anything you'd like to say along those lines?
No, nothing to add. Just thank you again, all of you, for your invitation. And I hope that this type of exchanges can continue moving forward now that technology and the wonderful interpreters allow us to communicate in long distance. So let's hope we can keep doing it. Thank you again.
Kathy?
Yes, thank you. I think there's a lot here that's very concerning and can be hard to receive. It helps me that there are good people who are working on this. If you don't have fracking in your area, keep it out. That's much, much easier than it is to deal with once it is already there. But also don't give up, because there's been some surprising victories where people have had their local government stand up for them. And the more the evidence accumulates and the more we spread the information, the greater chance that it will get into the hands of people who will finally say, no, this just doesn't make any sense. We're poisoning ourselves. We have to stop. So stay with it. I appreciate you showing up today to get more information.
Thank you. Fernando?
Muchas gracias por la iniciativa, por poder tener este encuentro. Para nosotros el lenguaje ha sido una limitante, como decía Nancy, muy fuerte sobre acceder a lo último que se sabe, a lo que está pasando en otros lugares, y la apuesta compleja, difícil, cara, que lleva mucho tiempo de poder traducir, ha sido una de las cosas que más satisfacciones o logros nos ha dado en este tiempo, poder tanto recuperar lo que pasa en otros territorios como poder contar en otros idiomas lo que pasa en el nuestro. Ha sido una tarea de primer orden de mi organización, y bueno, agradecemos la posibilidad de comentarlo en este auditorio tan ajeno para nosotros, porque veíamos las invitaciones y había mucha gente de Estados Unidos con quienes no solemos tener en el auditorio, así que muy contentos, agradecidos, y bueno, reconocer todo el trabajo que implicó el compendio, tanto en inglés como su traducción al castellano. Muchas gracias.
Thanks to everyone across the Americas for participating today. This really meant a lot to us to see the RSVPs from the southern tip of South America through British Columbia and Nova Scotia. We really, really appreciate it. And thank you to Che for putting on such amazing webinars. Every webinar they do is really fantastic. So watch their website, and we will let you know when we've done the bilingual Q&A responses. Thank you, everyone.
Thank you so much to Fernando, Kathleen, and Nancy for sharing this important work. Thanks also to our wonderful interpreters, and thanks to our participants for your thoughtful comments and questions. Again, this webinar has been co-hosted with Concerned Health Professionals of New York, and we're so glad to have worked together on this. I'll wrap up now with some quick announcements. A video recording will be available on Che's website soon, and you'll all receive an email with a link to the video. Please also join us on April 15th for the next EDC Strategies Partnership webinar, which will be focusing on children's health, assessing impacts of the exposome. We'll share that link in the chat now. We also invite you to follow us on social media and the organizations our speakers are a part of. We'll put those links in the chat now. With that, we'd like to thank you again for joining us. Thanks again to Carmi, Fernando, Kathleen, and Nancy for taking the time to talk with us today. And thanks to Kristen Schaefer, Rachel Massey, and Sarah Howard for their help behind the scenes. We hope to see you all again on future webinars.